So thank you for the lovely introduction, and I am incredibly grateful to have been asked to kind of share my story and my history with asthma, and kind of be the representative voice for young people with asthma at today's conference. Growing up with asthma, it has completely shaped my life in so many ways. Some have been challenging, but I have found quite a lot of them to be almost empowering, and that's kind of the perspective I've chosen to take on asthma, and it's kind of the perspective I encourage other young people with asthma to have as well. So today I want to take you through my story, and kind of highlight the importance of the two main principles that I have, which are resilience and self-advocacy for all young people with asthma. So could we go to the next slide, please? So this part will literally just be kind of like a run through of my history with asthma and kind of my story. So like I said, asthma has been a constant presence in my life. My early years were kind of marked, or as long as I can remember in my life, probably not all of it, but from my early years were marked with coughing fits, difficulty breathing, and frequent chest infections. And kind of one thing that I always remembered was that in my school bag, whilst everyone else had just like lots of fun stuff shoved into their rucksacks at school, mine always contained inhalers, medication, care plans, and some interesting looking spaces, which I always thought looked better off as props in a sci-fi film, but that's a whole other story, which were all there to kind of help me manage my condition, but were all things that other people around me didn't necessarily understand what the purpose of them were or why I had to have them. And then as I've gone into my later teenage years and now adult years, I'm faced in countless asthma attacks and hospital admissions, and testing, which all kind of started with a Halloween night that went incredibly badly wrong, and I ended up in A&E dressed as a zombie schoolgirl, which is not where you want to be. But I unknowingly that night kind of entered this new reality of my asthma being changing from this kind of well-controlled version, which kind of fits the profile that we're moving and encouraging all asthmatics to get to, where I took my 2 inhalers, but I had very few symptoms apart from in the autumn, but it was completely manageable, into this kind of volatile version of asthma where I was in high care admissions, and frequently in and out of hospital, so much so that my rhesus unit at my local hospital now knew me by name, and at any changeover of staff, at least one member of staff had treated me before. And it's kind of a surreal experience to have in your teenage and young adult years, that the worst case kind of scenario conversations that you don't ever expect to have with a doctor, or maybe you have once in your life, I was having on a fortnightly and monthly basis, and it kind of had become, I didn't really register how severe things were getting because I was having it so often. But I kind of had was decided that the worst part wasn't actually how often I was in hospital or the amount of attacks I was having, but it was kind of when I stepped back into sort of like normality or life with it, that was school or then university, that my friends and peers around me kind of were in this sort of disbelief that asthma could be that bad on occasions, or that I was just exaggerating what they believed had just been kind of a bit of breathlessness, which kind of leads me on to my next slide. So if we could, thank you very much, which is this idea of stereotyping asthmatics, which I necessarily didn't kind of realize I'd fallen for the stereotyping myself, but actually now having worked with the task force and the asthma, and then UK, the importance of stereotyping and kind of breaking down those stereotypes so that young people with asthma feel confident enough to kind of seek help if they need it, but also not shy away or think that their asthma is something to be embarrassed about. And I think if you are able to break that down, you're able to get into like this state where they have better control of their asthma and so don't have the symptoms, so don't even need to be embarrassed in the first place. Well, that's the hope. But when I was trying to figure out why people had these distorted perceptions of asthma compared to other conditions, the main thing that kept cropping up was this cinema or social media, and how they've characterized the asthmatic as a character as being weak or unfit or the butt of jokes, which kind of now that I've seen it, I actually can't unsee it. So when I watch films and I've now identified a character that does that, kind of makes me really frustrated. And initially, when I'd seen these films, I didn't understand, again, like I said, I didn't understand the importance of what those lines meant. I kind of had just disregarded as that person having asthma in the film. But it subconsciously generates this bias or this idea that the public then has, and you can't kind of shake it because you're persuaded to believe that that is the character profiling. So it's something that I think has unconsciously persuaded everyone, either those with or without asthma, to believe what an asthmatic should look like in society, and really kind of now bugs me. But the other part of that slide, this slide, is about misdiagnosis. And by misdiagnosis, I'm not kind of referring to the healthcare setting, and by healthcare professionals, it's more, again, in society and in public. So for me, if I refer back to that first life-threatening attack I had, which kind of shifted my asthma into kind of the severe version that I have now, the first kind of person I went to seek help that day decided that I was just having a panic attack and I was being a teenager and I was being melodramatic, even though I was trying to explain to them very badly through breathing that I have asthma. I know what my attacks are usually like. This is not it. This is something a lot worse and I need help. And I think that that ended up delaying my treatment. But that was also one of the first times I'd actually publicly asked for help with my asthma. And then because of the response I got, it's kind of generated this barrier now that I have, so that I generally don't go up and ask people for help anymore with my asthma if I can avoid it, because the response I got that day was so bad and kind of traumatized me in another way, as well as the asthma attack that I had, that I kind of refused to seek help, which I think is not what we should be doing. We should have actually be encouraging people that if you need help, you can go and ask someone for it. So I think that kind of, it was all these kind of small moments I had that kind of encouraged me to want to be more involved in understanding asthma awareness and also being able to raise asthma awareness as someone with the condition. And it kind of drove me into the role that I am in today and ultimately speak today at this event. Next slide, please. So kind of following on directly from the idea of stereotyping, if you look at the table on that slide, you can see these are the top 10 words used by the public to describe an asthmatic. And I find it kind of interesting how it's not even a positive word. The least negative word in that 10 is normal, but it comes 8 out of 10, which is bizarre to me because having asthma doesn't make you any less normal, or it shouldn't really be your defining characteristic. It's something that I've always kind of said to everyone. And one of the reasons why I kind of hide my asthma and the symptoms I have is that I don't want to let people refer to me as Izzy who has asthma or Izzy who is in hospital a lot. But I think for some reason we kind of add these connotations to asthma, but not in the same way that other conditions have. So when I speak to other people I know who have other chronic conditions, there isn't this kind of stereotyping the same way as asthma has the stereotypes. And I think a lot of that is generated by the media, because if you look at the chart next to it, you see that the demographic that generates the most negative perceptions of asthmatics is the younger generation. And they are the generation most exposed to things like social media or the pop culture and cinema. And I think social media definitely has a role in generating this kind of perception and influencing young people, well, influencing everyone, but especially young people. And I think that having more asthma awareness campaigns where we're pivoting the story away from asthmatics being negative and being a weak role model into just kind of normalizing that asthma is part of, maybe a small part of someone, but by no means their defining characteristic, actually will help inform, and for people with asthma, make us not feel so reluctant to get help or like feel so kind of like an outcast, which is something that I kind of has encouraged me to speak up more about. Next slide, please. So in terms of what asthma has taught me, it's these two principles of resilience and self-advocacy, that has really encouraged me to speak up about my asthma, but also then get involved in the campaigns that I work with now. And I think definitely as I crossed between being a pediatric patient into adult care, I didn't realise that I went from being sat in the chair next to my mum, but my mum handling all my care and me just sitting there clueless, to having to kind of take control of my care. And I think the biggest way I did that was I educated myself about the condition, which is why I got involved in the areas that I've got involved in. And actually by doing that, I realised that I had missed quite a lot of the crucial steps involved in asthma care in my primary care stage. And the main campaign that you're seeking, which is to not have symptoms or be able to have very few symptoms in your life. I didn't actually know that was possible in the first instance with asthma. I kind of just thought that I would always have symptoms and that would be me and that was fine. I was happy to deal with that. So I think I'm constantly learning about my asthma. And I think that it's almost encouraging to really continue to raise that awareness with other people, but especially the younger generations. So next slide, please. So this is kind of just breaking down the 4 kind of pillars that I based on as a patient, and also speaking with a lot of other patients when I've gone into schools and just generally spoken to other patients with asthma. The 4 main areas that or the common areas that people want to see improvements in. And they're kind of the obvious areas that most people will think of anyway. But in terms of education and awareness, it's this idea of having all sectors be kind of made more aware or educated on what asthma actually is, and not what social media has informed you that asthma is, or TV has told you asthma is. And especially in schools, being able to increase the general education of what asthma looks like, or what an asthma attack looks like, so that you don't kind of outcast the asthmatic child, which unfortunately throughout my childhood I was the outcast on certain things. And it's that idea that because you have asthma you can't do certain things. So like I used to get kicked out of sport class sometimes, which is ridiculous, because then I went on to row in university competitively. So sport was not a limiting factor. I definitely could have done it. But it is because of this kind of poor level of education on what asthma is. That meant I spent a lot of time actually excluded for no real reason, but that had detrimental impacts on what my perception of my condition, and kind of made me hate it, which was stupid. The second, which then leads directly onto the second point, which is positive media representation, to kind of shift this idea that asthma isn't a weakness and it's not like a defining characteristic. It's just an element, the same way as me having ginger hair is an element of my life. But it needs to be more positive to kind of empower young people to not feel ashamed of having to take their inhaler maybe in public, or just pack their inhaler in their bag. And then the third point is kind of improving healthcare support. So one thing that I really actually noticed from moving in from moderate asthma into severe asthma is that the support level shifts. So I now have access to a lot more support services to kind of encourage me to kind of speak actually about my asthma attacks and about how I feel about my asthma generally, which you don't have under mild or moderate asthma. And I know that's a lot to do with services and funding, and I get that, but I think asthma care can change a lot if actually it's informed by patient voice. And I think especially because each asthmatic is slightly different, and there's not kind of one, there is a set of criteria, but then it changes a lot based on the person's triggers or where they live. And there's so much personalization to an asthmatic that I think we really need to kind of increase the role of the patient voice within asthma care. Because on occasion where I felt belittled or like turned away, that then turned me away from seeking help. Whereas the kind of care plan I'm under now, I'm actually encouraged to speak up as much as I want to, or as little as I want to, based on my appointments, which I now kind of want to translate and make other people feel that they can have that same access. And then the final element is empowering self-advocacy. So this is kind of a point more for patients themselves. So it's encouraging young people to kind of speak up about their asthma, whether control, how they can navigate the healthcare system to maximize it so that they get the best out of their care, to get the best out of their health. And also just so that they feel that they have some level of control. Because for me, when my condition changed from being a well-controlled mild moderate asthma to this severe asthma form that I have going on now, I really felt like I'd lost all control, and I've slowly been gaining it back through the work I've done and working with my healthcare team, who are amazing. But I think it's good to encourage actually all patients with asthma, especially young people, as they transition into taking charge of their own asthma care when they turn an adult, that they have got control over those crucial steps. And then if we could go on to the next slide, please. So this has kind of been a very quick talk, because I know there are much more interesting talks coming later from the professionals, but I do hope that by sharing my story in some way has kind of encouraged you to listen to patients more, and kind of encourage your patients, if they're in the young patient category, to rewrite their version of asthma, so that it's not a negative in their lifestyle, whereas it's normally attributed to that because of schools and the teenage democracy, which is a whole thing in itself. And I think that honestly, it kind of brings me over to the phrase that has the statement that's kind of summed my life up over the last few years, which I'm not going to try and speak in Latin, but it means while I breathe, I hope. And I think it kind of really encapsulates this idea of resilience that asthmatics need to have, or like any patient should have. So for patients, it's this idea of hope that there will be new treatments, or that they get better control of their asthma care, and that they can kind of get this deeper understanding of the mechanisms of asthma to inform their care plan. For healthcare workers, it's this idea that their hope is to help their patients gain that status of having no symptoms and being able to kind of carry their inhaler but never need to reach for it. But for me, it's kind of this hope that's driven me into advocacy for asthma awareness, the volunteering roles I have with Asthma and Lung UK and the task force, and kind of ultimately why I'm here speaking with you today. So kind of all in all, quite literally, while I breathe, I hope that asthma awareness will reach the level of understanding and support seen for other conditions, and that we can kind of integrate the patient stories more into research and healthcare systems to kind of form this voice that encapsulates every part of the condition, and not this set criteria that we've had for so long, that if you don't tick, you kind of get lost in the system. And so kind of my final statement on my view of my asthma is that although it can be overwhelming at times, I kind of always hope that it's never going to take over my life or dictate my life and my aspirations. So far it hasn't. I've been able to achieve everything I wanted to, and I'm kind of hoping I get to stay on that avenue. But it's this idea that I hope every young person with asthma can work towards this kind of level of understanding, and so that they feel empowered to speak up, seek help, and live their life to the maximum. So thank you very much for listening to my talk this morning. And yeah,